This video is a basic introduction to dental implants. A dental implant is used to replace a missing tooth. It's really comprised of about three components when you add it all up. It's the actual implant itself that goes down where the root used to be, and then an abutment gets put on top of the implant, and then a crown is put on top of the abutment. So you take all three of those components and you put them together. That's what's going to be the entire implant restoration, tooth replacement for the patient. In this slide, you can see again kind of a similar picture. It shows now it all kind of connected. You can see the implant is down here where the root would normally be. On top of the implant is this thing called the abutment. And then on top of the abutment is the actual crown itself. Now let's go over that process and how that works. Okay, the first stage is that the tooth is taken out. Okay, now sometimes patients already have a tooth missing from a while back, and so they're ready for the implant now. But for others who have the tooth that's gone bad, the tooth has to come out first, but then the implant doesn't just go right in. Okay, there's usually going to be about 3 to 4 months after the extraction before the implant goes in. Okay, so the implant then goes in, and this is actually placed by an oral surgeon. Okay, then usually the extraction might be done by an oral surgeon, or we might do it in the office, but the implant's going to be done by the oral surgeon, or it could be a periodontist as well. After now 3 or 4 months have gone by, that socket is filled in with bone. The site is now ready to have an implant put into it. And so here you can see the implant has been inserted and it's in place, and it has to sit inside the bone for about 3 to 4 months or so for the bone to grow tight around the implant. When that implant is now tight inside the socket or inside the jawbone, now we're ready to move on to the restorative phase. You see there's two phases. You got the first phase, the surgical, which I just explained is the extraction and the placing of the implant. But then there's the restorative phase, which we're going to get the implant fitted for an abutment and a crown. And that's where we come back into the picture. So the oral surgeon will have placed the implant. When they say, okay, it looks like it's tight into the bone, is that now they're ready to have the patient's ready, the implant is ready to now have the restoration completed. And that's where we come back into the picture. At that point, we'll then make an abutment and then put a crown over the top of that. In the next couple of modules, I'm going to show a little bit more detail of how that process works, but that's just kind of the basic run through on how dental implants work. All right, thank you.